Hey everyone, welcome back to our webinar series. I am so excited for tonight's webinar, and I hope you're just as excited because we have a wonderful guest speaker here this evening, and she's eager, I know, to get started as well. So why don't we just jump right into it, and hopefully people can start coming online. And of course, you have your comment section on there as well, so you can post your questions or give us some compliments, and please by all means share this webinar with everybody. We definitely want to expand the knowledge out there so everyone can get some great information. So with that said, let's learn about me first off and foremost. So I run HealthEquine Therapies out of basically the Niagara region of Ontario. We take a more holistic approach using alternative medicine and therapies, which is now preferred by a lot of trainers and riders these days. So in order to create an environment for the maintenance and restoration of health of the horse, we want to consider the whole totality of the horse. So we just don't look at the body and think, okay, well, we'll focus on skeletal system or focus on massage. We like to really kind of combine them together. And so we do that by thinking about various aspects of the horse's body, whether it's internal or external. So we know that the body will strive to heal, repair, and maintain itself as long as we can provide them the right conditions. So we totally work with the owner, obviously work with the horse, and make a program that's going to be very beneficial for the horse and overall performance of the horse to make the rider happy and the owner happy. So with that said, we might as well bring our guest speaker in here tonight, and I will introduce her formally to you. We have the wonderful Miss Dr. Kendle Dykstra. How are you, my dear?
I'm good, thank you. How are you?
I'm doing well. Thank you so much for taking the time to come and talk to us tonight.
That was my pleasure. I'm excited to be here, and thanks for having me.
No problem. I know there's quite a few riders, trainers, coaches out there that are eager to kind of learn from you this evening. So it's great that we can actually collaborate and put our two professions together so that we can help all these wonderful equestrians out there.
Absolutely. I couldn't agree more. It's, lots of people that make a team run and function optimally. So I'm super glad to have people like yourself to work in conjunction and collaboration with.
Awesome. Well, let me give everyone a little bit of idea of who you are and your little bit of your background here.
Sure.
I'll just switch you over. There we go. So Kendle started horseback riding at the age of 6, and over the years she's dabbled in various disciplines. After years of wear and tear from the equestrian sport and, of course, physical demands of farm work, she sought chiropractic care for herself, for pain management, and just over health and well-being. She gained a strong respect for the natural approach of chiropractic care and how it helped her body to perform and operate in the ways it was designed to. With that in mind, she sought chiropractic care for horses and was amazed at the difference it made in her and their performance. As in the way of most animal lovers, Kendle always had an aspiration of becoming a veterinarian. So she went to Brock University to obtain her Bachelor of Science. However, when she realized it was not the career path for her, she quickly fell in love with the idea of becoming a chiropractor. She attended New York Chiropractic College for her doctorate of chiropractic, as well as Veterinary Chiropractic Learning Center for her animal chiropractic training. Kendle now offers chiropractic care for people out of Fonthill, as well as an animal chiropractor services to the Ontario Niagara region. With her background in equestrian sport, she has the understanding of the physical demands on the equestrian body and a special interest in helping riders and their equine counterparts to perform optimally and in unison with each other. Hopefully I didn't miss too much out of there.
No, you did great. Thank you. That covered everything.
No problem. No problem. So we've got a couple of questions that I kind of want to address, and then I've also incorporated some that I received online. But first and foremost, let's just ask, how did you get into horses?
Oh my goodness. Honestly, I think it was something as simple as my mom asking me one day if, I ever would be interested in horseback riding, and because she had dabbled in riding just leisurely when she was a kid. And I said, yeah, sure, why not? I loved animals, so had no, aversion to the idea of riding horses. And I was hooked pretty much immediately. And it has not stopped since. So I don't know that my parents really realized what they were getting themselves into at that point in time in my life, but here we are.
Awesome. Yeah, like it's funny how we have this passion for our beloved horses, and whether we start at a young age or, a more senior age, there's always that connection with the horse. And it's nice to see that connection go a little bit further than the barn, whether it's like taking on a career or a professional aspect of it. And so, like, did your discipline decision kind of incorporate into that? Like, did you kind of your equestrian dream come from how you were riding?
Yeah, so I really just, like I said, like when I was riding, I definitely had an appreciation for the aches and pains that could come along. And yeah, when I realized just how important it was to address the whole body and in a natural way and help people, like it really just fueled my connection with my horse along the way too, because it made me more sensitive to the stresses that I was putting on my own body, and then and respect my horse, and to see them respond to my positioning and everything as well as they do. I knew, like, okay, like when I can really tie everything together, like something special can really happen here.
For sure. And there's a lovely photo of you jumping right now. And so what kind of disciplines did you actually dabble in to get an idea?
Yeah, so I actually started out riding Western way back in the day. And I had fun and I enjoyed it. And then, as I had to, change barns from people changing places, things like that, one of my coaches that I went to after my first one had said they wanted me to get some more basics, just in like English tack and a little bit more of an English style of riding before I switched back to Western. So I said, okay, sure. I didn't care. As long as I got to ride a horse, I was happy. And then I remember it very well. First day, she, after riding English for a bit, and the first time she let me pop over a tiny little, like not even 18-inch X. That was the same day she asked me if I wanted to switch back to Western, and I was so hooked on jumping that was it. I was like, nope, this is where I'm going. So I definitely stuck more down the English path and disciplines after that. But I did dabble a little bit in Western again, as I had a horse. I was fortunate to have a horse who let me do a little bit of everything. When I first got her, she was well versed in everything, so I did still play around a little bit in both. And then, yeah, as I carried on my English career, I had done a little bit of dressage for, a little bit of time with one horse, and then started in the hunter ring mainly. And then once I got introduced to the jumper ring, that's kind of where another fire got lit inside of my soul. And so that became a special place for me, and definitely was my preference after that point. So that's kind of what I like to think that I stuck to the most, but it's definitely been a little bit of everything over the years.
Perfect. So did you ride on any of like the circuits here in Ontario?
Yeah, I've done everything from like little saddle clubs, and then back in the day when the Cup Series was the Challenge Series, I did that for many years, and then also showed on the Trillium Circuit in the Central West Zone. So yeah, I kind of played around in a lot of the more local and then some less local shows as well, and really enjoyed all of it.
Awesome. Well, let's dive deep into all this chiropractic care. I know there's some eager viewers out there that want to hear more. So
for sure.
We heard that, you wanted to be a vet, and I can totally sympathize with that because I wanted to be one too. And it's kind of neat how we kind of went into kind of the same areas, even from our love of wanting to be a vet. But
Absolutely.
What influenced you to become a human and an equine chiropractor?
Absolutely. So when I was younger and, trying to decide what I wanted to be, I had considered chiropractic school for a little bit at that point in time. But then when I realized I had to move to a city to do that, and as I kept riding and being more addicted to the horses, I was like, no, I'll go the vet route instead. And then as I worked as a vet assistant and started to realize the vet life wasn't the life for me, I kind of got back in touch with that thought I had when I was younger about being a chiropractor, because I always really appreciated how much my chiropractor was able to help me and how much benefit I got from it. And in doing so, and as I started to think down that path of being a chiropractor, I also knew that if I became a human chiropractor, I could get the additional training to also do chiropractic care for animals. So that was really the final little nudge I needed to commit to that career path, is knowing that I'd be able to incorporate horses or animals in general into my career.
Very good. Do you have a preference? Like if you could do one full time, I'm pretty sure I know where this would go, but if you had a preference to do it full time, what would you do?
I think the animals would pull me a little bit more. I love working with my people, but there's something really special and unique about connecting with various horses or animals when you're doing this kind of body work on them. And I think it's great because they don't always have a voice to really tell us exactly what's going on. And so it's just a nice way to connect with them and communicate with them based off of subtle signs that they're showing me, to really make sure that their voice is being heard if there's something going on. People, we can say, hey, this is really hurting me and I need this area addressed, whereas animals, it's not always that as clear. So giving them a voice and really being able to help them through some tough stuff is what really grabs at my heart and gives me the best feelings at the end of the day.
That's wonderful. So I did hear you say horses and animals. So do you dabble in the small animals as well?
Yes, I do. Definitely my horse clientele is my main clientele for my animal practice. But I absolutely treat dogs. I've treated the odd cat as well. And definitely played around on some of my other animals around the farm, such as my goats and my cows and stuff like that. But that is not a main business for me by any means. But yeah, definitely more dogs than cats, and then more horses than dogs.
Perfect. You are a busy bee.
It's a good kind of busy. I love it.
Awesome. So talking about chiropractics and adjustments and things, what is chiropractic medicine? What is it exactly?
All right, great question. So chiropractic, what it does is it restores function and movement to the joints in our body. So a lot of people think it's just localized to the spine, but actually there are any joint in the body we can work on and improve the mobility on. And in doing so, we will use what's called a high velocity, low amplitude thrust. And all that means is we don't use a lot of force, but we use really quick stimulation of motion to a joint that is restricted in the motion it's supposed to have in order to restore its full function and range of motion. And then there's a lot of benefits associated with that, such as pain relief and helping to stimulate the nervous system as well, and having a lot of effects on the whole body, as well as the muscular system, the nervous system, and then the skeletal system itself.
Crazy how everything is kind of interconnected in that way, isn't it?
Very much so. You can, work on an area very far from the brain and then really have a really potent stimulation higher up and the whole pathway there as well. So it's fascinating.
Very much so. Is it safe? A lot of people are questioning the actual aspect of chiropractics and, should they go, shouldn't they go? And it always comes down to, is it safe for them?
Of course. So with anything, there are always going to be some degree of risk factors, but overall, we do a thorough history and exam to make sure that it is an appropriate treatment for the patient. So of course, there are going to be some cases where it is not appropriate, but overall, many, many people can benefit greatly from it. So as long as nothing stands out in the exam that is done to indicate that it wouldn't be an appropriate option for that that particular individual. Again, that is not a regular common thing. Those are definitely a little more few and far between, but of course they can happen. So yeah, overall it is very safe. What I love most about it is how we're not throwing anything new at the body or doing anything different to the body than what the body's already designed to do and what it's meant to do and has done, at stages in our life. It's really just addressing those what we call mechanical dysfunctions that come up along the way from, different stresses on our bodies and lifestyles and things like that. So it's really just getting the body back to doing what it's originally designed to do.
And I can attest to how thorough you go through, because obviously as one of your patients, that initial assessment, you went pretty deep into like my history and asking specific questions so that you knew exactly what you could do, and then obviously doing the assessment on my body to see where I needed any help with. And also we hear this term all the time, chiropractic adjustment. So what does a chiropractic adjustment entail?
Yeah, so what we do is, as I've mentioned already, joint dysfunction and mechanical dysfunction is really what we're looking for. And what this means is we're going to assess all of the different joints in our body. So between every vertebra, from your neck all the way down to your pelvis and the base of your spine, and any other joints that we're paying attention to. So whether it's your ankles, your wrists, your shoulders, your knees, your elbows, and assessing the motion in those joints to see if there is a degree of pain there or if there's a restriction in its motion. And the chiropractic adjustment is when we use that high velocity, low amplitude thrust in the plane of the motion that is being restricted in that particular joint so that we can restore function and that regular motion that it is supposed to have.
Awesome. Well, that helps people understand. So does that terminology of when something is out of alignment, a lot of people think, like they have part of their joint that's dislocated in a sort of sense, or like a rib that's kind of twisted and out of place. So maybe you can kind of just focus on the faux pas or of, when someone is out of alignment.
Of course. It's definitely a common terminology used. And some chiropractors will even refer to things that way as well, because I think that's just a way that people can kind of grasp or have a feeling for what's going on. But again, we're not pushing anything out of place or pushing anything. If it is out of place, we're not pushing it back. That is definitely a medical situation where you would need to see a medical provider to receive the appropriate care. So what we're doing is we're restoring that motion, because what can happen when those joints get locked up or seized up is they can be stuck, if you will, and restricted in part of that motion that they're supposed to have, which may make them positioned just a little bit, more rotated to one side, or a little bit, like pushed forward or rocked back. So it's not necessarily that it's out of a range of motion that particular joint is supposed to have. It's just that it's stuck in a part of that range of motion and isn't really accessing and going through the full range that it is supposed to have there. So we do the adjustment to stimulate that motion back into that range where it is not going as willingly, just to make sure that we get that symmetric and even movement throughout the joint itself.
Awesome. Well, hopefully that clarifies some things for some people, because I know there's a few nervous Nellies out there, and I'm going to admit I was very nervous when I was told I should go and get an adjustment.
For sure.
And I think my biggest concern was, is this going to hurt? So is this, it seems to be a bit of a major concern for people. So is this true? Will it hurt if anyone new is going to try out some chiropractic care?
So generally, no, it is generally a very comfortable, and again, like I said, with the low force, it's not like we're, really going to be doing a big drop down with our whole body, to restore this motion. So it is a very quick little motion that is quite effective at stimulating the joint, so we don't have to use that brute force. So generally, it is quite comfortable. Now that being said, if someone is in a very inflamed state, or they've just injured themselves, and there's a lot of inflammation in that area, and potentially some trauma to some of the associated structures in the area, then it's not going to be as comfortable to have that particular area worked on. But that being said, there's a lot of modifications that can be done when people are in that super inflamed state to keep them comfortable, while still trying to improve the mechanics in those joints to minimize that inflammation and to help support them as they're healing. And then, eventually we can generally go back to doing the normal style of adjustment that would normally be done in order to keep the patient the most comfortable all the way along. So typically it's a very comfortable, should be a very pain-free process. But again, if there's an acute injury, then things can just be a little more tender than they would be otherwise.
Perfect. I think the idea of getting a chiropractic care, not only will it hurt, but those noises, those popping and cracking noises, and people think that's again that faux pas, or when they're out of alignment and you kind of put the adjustment in and then you hear that pop or crack, and that it can be quite scary to think about at times. So is that something that should be worried about? Do you know the science behind it? Like, what's making that sound?
Absolutely. So that noise it's not your bones cracking. It's not anything snapping or breaking or anything dramatic like that, even though, that's the terminology often used, crack a back. But what that noise is coming from is the gas that sits in those joints being released when we stimulate them. So in doing the adjustment, we often change a lot of the pressure within those joints because they've been compressed and squished down, whether it's from gravity or, certain positions or stresses we're putting on our body in the restriction that keeps those joints from moving as well. So we don't get as good of, we get the gas coming in, but we don't necessarily get the same releases because things are really constricted. So in doing the adjustment, we change the pressure inside that joint, which causes the gas release. And that is what we hear when we hear that pop. So it's no different when, if you're someone who cracks their knuckles or their toes or things like that. It's the exact same process that happens in our back when you hear those cracks as when we do those little cracks through our fingers or the rest of our body. It's the same process. So it's nothing breaking. It's just little gas pops.
Good to know. And I just got an idea on the top of my head. When you're making all these adjustments and you're putting things back to where they're supposed to be, that wear and tear on putting it back, can it be temperamental down the road? Can it cause something like arthritis or anything if you have to keep putting the skeletal system back together?
It's a great question. So it's actually fascinating because it's actually the opposite. So if we actually have joints that don't move and we have immobility, we can call it, in any joint, that is actually going to encourage that process of degeneration and arthritis to actually happen faster than it would if we did have the regular motion that's supposed to be there. So same kind of mentality of if you don't use it, you lose it, happens throughout our body. So we need that stimulation, we need that motion in order to keep those joints healthy, because the motion is also going to help bring in good nutrition and oxygen and the appropriate nutrients for healthy joints. Movement is what gets that nutrition to diffuse in. So there's, joints have a lot of vasculature that comes near them, but it's not right in the joint itself. So we really need that motion and compression and extension to really help pump the nutrients that are coming from those blood vessels to help them seep into the joint fluid to keep everything healthy and happy and moving well. So it's a bit of a combination of things. So the motion itself is very beneficial to minimize the arthritis and degeneration that can happen, but then it really helps to keep the joint fluid healthy as well.
Perfect. So by having, I'm going to keep using these funny terminologies, by popping the bone back in or being set back in alignment, you're actually reducing the an aspect of having inflammation happen, right? So if you're out of alignment, you're more prone to having some sort of inflammatory response because the body's not in its perfect mobile state. It's not puzzled back together. So
Absolutely.
right. So you would have less accountability when it comes to having that inflammation occurring as if you were to have it popped back in, so to speak.
Absolutely. So again, that motion that we restore really helps to, not only bring the good nutrition into those joints and surrounding areas, but it also helps to pump that inflammation out, and get that moving along and cleared away in our system. You can imagine if you had a big swollen foot and you just sat with your feet on the ground and didn't move around or walk around at all, it's going to be really hard to get that inflammation that's sitting there to move anywhere, because we don't have those muscles contracting. We don't have those joints moving, stimulating our venous system, like our vascular system, to help pump that stuff out and away. So it absolutely helps to get any inflammation that's there out of the way, while also minimizing the amount of inflammation that's going to come in.
Perfect. So although we've given a lot of people the idea of it, why should riders consider chiropractic care?
Well, this is a loaded question. So as a rider myself, I can, say firsthand, there's so much benefit to the rider in your effectiveness as a rider and your ability to control your body and move your body and give those subtle cues to our horse that, we pride ourselves in being able to, communicate with them so well, this big 1,200-pound animal, and use those subtle little clues or cues to get them to do the various things that we ask them to do. So whether, it's jumping, flat work, anything, any discipline, it's a lot of subtle communication with our animal. So when we can use our body as efficiently as possible and be as comfortable doing it ourselves, not only are we going to be able to stimulate and cue our muscles more appropriately, but we can also keep more even weight distribution through our seat and our saddle, and just be able to use our bodies more evenly so that we can minimize, that miscommunication that can happen, sometimes when we don't realize we're doing the things we're doing. We can really help to even our body out side to side, so we can really try and be as clear and concise when we're communicating with the horse as we can.
Perfect. And how can chiropractic care help with the riders? We've learned a little bit of how it benefits us as just a human being in our bodies, but as a rider, like you said, we have that connection with the horse, and so just our subtle cues can be very detrimental to the horse and their performance. So how can chiropractic care help with one's riding?
Absolutely. So, sometimes riders will experience pain when they're riding as well. So that when we do experience pain, it very rarely stops a rider from riding, but it will absolutely change the way that we're going to position ourselves and utilize our body. So it can help the rider in pain management, so that, we're not compromising our position and the way that we're moving and using our body. So again, just keeping things as symmetrical as possible, side to side. But then it can help actually improve our communication through our limbs and through the rest of our body. So when we don't have joints moving well, we're not getting the same information being sent to our brain to tell us what's moving and where it is in space. And when we don't have that information coming in, our brain can't give the proper output to say how to use our muscles and use our limbs and engage certain areas. So then when we're getting that miscommunication, and then that can further cause that exacerbation into more joint dysfunction, because we're continuing to use ourselves poorly. So by keeping the joints moving well, that sends a ton of great information to our brain, letting our brain know where our body is in space, so it can then send that proper output to our muscles and the rest of our body to use ourselves most efficiently, because it knows exactly what is going on through those joints and through those limbs all throughout.
Perfect. So there's aspects of obviously improving the biomechanics and making sure that we're more symmetric on our horses. I think another one would be what we talked about with inflammation. It would decrease any kind of pain that we might have from either riding or just our daily lives and activities that we might be involved in. So with that said, what are what are some of the signs or indications that a rider might need an adjustment? I mean, we always look towards our horses getting the best care and getting the best supplements and getting the best coach out there so they become more effective. But how does a rider know that they need a little bit of an adjustment?
For sure. So this can present in various ways. Obviously, I've mentioned that pain can be a component, especially if it's something that you're really noticing associated with your riding. So whether it's during the ride or after a ride, if you notice that you're always in pain, and more than just, oh, I worked out pain, it's like, oh, now my low back really hurts, or, oh, now my muscles feel really tight. And it's just kind of standing out as being an area of discomfort, but it doesn't always have to be pain related. So pain is tells us a lot, but I really like to emphasize the importance of picking up on more subtle things, so we can avoid getting to that pain stage before we start to do something about what's going on. So it can be things like, if you're having a hard time really feeling symmetric when you're riding side to side. Of course, we always have a dominant side where things are going to be a little bit easier. But if you're constantly getting the same input from your coaches, no matter what you do to try and improve, and work on that particular area of dysfunction, if they're always saying, oh, like sit up straighter, or, be able to open up through your pelvis, or, you're always weighted to one side, or it can go in so many different directions, but those are some really common things that can be because of the joints not being able to move properly, even though there's not pain there. So, our body is really great at minimizing pain for as long as possible. So catching things before they become painful can still be very beneficial for the horse, so that we can really make sure we are sensitive to what position we are putting ourselves in while we're riding, and really being able to engage our body as effectively as possible, especially when we're hitting some of those roadblocks that it seems no matter what we do, we can't seem to cross that bridge.
So basically, if we have a very nattering coach, and they're picking on the certain things constantly, lesson after lesson, day after day, it's probably something maybe that we should consider is getting some sort of body care, whether it's massage or Bowen or even chiropractic care. It's maybe something the riders need to think about. I know, again, for myself, that I did everything for my horse. They get chiropractic care. She gets massage. She gets equibo. She has good supplements. She has great coach that gives us some really well in tuned lessons. She gets her saddle fit every 6 months or so. So I stay on top of everything. And there was this time when I would have to get my saddle done more frequently. And it was kind of starting to get frustrating because it was weighing on my wallet a little bit. And finally, the saddle fitter said, have you gone for chiropractic care? And I was like, no, why? Like, I think your hip might be a little bit out. And that initial aspect, I was like really nervous, really scared because I hadn't had one. I didn't know if it was going to hurt, or, a lot of people think, oh, I don't want her to touch my neck. I don't want anything done with my neck because that's really bad. But as a rider, obviously, I looked at all the underlying conditions and ruled out everything for my horse, but didn't really think about myself. So what body issues might a horse have that can be reciprocated from a rider that doesn't come and get some chiropractic care?
Oh,
Big question.
Several things. And I mean, the one that comes first and foremost to our mind is usually some kind of back tenderness. If we have been loading ourselves unevenly on their back, so one side of their back is maybe taking a little bit more brunt force, if you will, and just a little bit more concussion or a little bit more weight, unevenly and more consistently, we can see that. But I often have found when I do get the chance to work with the horse and the rider, I have very commonly found very correlated findings in areas of restriction in the horse as well as the rider. Now, to say which came first and who did which to who, I can't necessarily always pin down because, I'm kind of jumping in the middle of the story between the horse and rider often. But it's really been eye-opening to me just how directly related a lot of those joints and areas of the body can be. So I've absolutely had a horse and rider where the same side pelvis, the same side shoulder, the same side neck, like, and it really correlated in each of those same areas of motion, even though, you know, they're a quadruped, they're positioned differently, gravity's working on them differently than us being upright. You know, we're obviously engaging our bodies in slightly different ways, but I've still found a lot of correlation between both the horse and the rider, even though it's not always pain, but there's definitely been a correlation there between the same areas being involved for both.
And I can totally agree with that as an equine massage therapist, because there's times when I keep going back time after time and there's the same issue occurring with the horse. And I turn around to the owner, the trainer, and I said, how's your body been feeling lately? You know, how have you been sitting in your saddle? Do you feel like you have to keep adjusting your saddle to one way? And it's surprising how many people or owners actually say, yeah, you know, I've had to like put more weight into my right stirrup because I feel like my saddle's slipping to the left. And I'm like, you know, if you had your saddle looked at, yeah, he's come out and looked at it, everything's fine. And I said, have you ever thought about yourself? Right? Like, again, we always put our horses first, like Sherry Miller said in the comments there, and we never think about ourselves. So what are some of the common areas of concern or dysfunction in horse riders?
Oh, well, there's definitely, it's not just one spot for sure. But some of the main areas that I find really prominent for a lot of riders, regardless of the discipline, again, is I'll work from the bottom up. So ankles and ankle movement is huge, moving up to the pelvis and, you know, that low back region, but especially that pelvic area where we're really controlling our seat bones and the weight we're feeling in our seat bones. And then the front side of that, we can get some muscle imbalances too that I'll get to in a second. But then working up the body, definitely through that mid back. So kind of between the shoulder blades and that shoulder blade region, and then the ribs that are associated in those areas. You know, we definitely have to keep a good posture while we're riding, but I find that a lot of people get restricted through that area, and it just further exacerbates how difficult it can be to keep the good position in our upper body, and it often starts in the lower body. Now in this picture, you can see some of those muscles that I started to allude to. So on the inside of the pelvis and the very back of our body wall, kind of tucked behind our organs, there's a muscle called iliopsoas, and that one is involved in hip flexion. So you can imagine when we're riding, we're doing continual repetitive, we're sitting in hip flexion, if we're posting, we're obviously expanding and opening up through our hip, and then we're going back into a controlled hip flexion. So that muscle works very hard and often gets really tight in a lot of riders, and can cause some more turning out in the legs when that muscle is really tight, and some hip pain as well through the front, and just having difficulty really kind of opening up through your body and through your pelvis when you're trying to really work with your horse's bend and bending with them. That muscle can definitely play a role in inhibiting that.
So obviously you're a chiropractor and you're just talking about that particular muscle group. So how do you release that tension on that muscle in order to, you know, open up the hips and that pelvic region? Obviously, you're not cracking anything into place per se. So how do you help with that kind of component?
So I definitely do like to do a bit of muscle work in my treatment. So I do like to target some of those main areas that are related to the individual's complaint. But that being said, you know, I'm not a massage therapist and I don't pretend to be. So I definitely think that making sure that a massage therapist is part of your care is very important and very essential. But I will do some manual muscle work, but I always give homework, if you will, to my patients, because I never want my patients to rely on me either. I want you to be able to work through things on your own and be able to maintain yourself as well as possible. It's not all me. I am here to facilitate that and encourage things to head in the direction we want them to go, but it really does take some effort from the rider. So I do give some homework, and I try and keep it, you know, basic and simple so that it is more willingly to be involved and utilized, because I know we can be bad for, we'll do our horses stretches and not always stretch ourselves or do some exercises for ourselves. So I will involve some hip opening exercises for psoas to really help open that up, because I find that's an area that really needs continuous work. Me just doing some muscle work, every couple of weeks or so usually isn't quite enough to keep that relaxed for a long period of time, just because of the nature of how much we engage that muscle on a regular basis.
So thinking about obviously any kind of muscle tension, when we come into your office, if we got an appointment with you, how do you, other than manually loosen the muscles, are there other things that you do to order to soothe the muscles so that you can adjust a rider more easily?
Absolutely. So, as we said, obviously I do some of the manual work, but then I'll use other tools, like one we call a thumper, which sounds
The horse people know that one. Yeah.
yeah, it sounds a little dramatic, but so basically like a handheld massage gun that's really going to help stimulate. It stimulates the joints as well as the muscles, but has a really great relaxing effect. So that's something I definitely like to utilize anywhere I can. Obviously, for example, for that iliopsoas muscle, that's super deep. I'm not going to be able to affect that manually or with the thumper either, but definitely running that all through the areas of involvement to help get that relaxation there. And then I also really like to use taping. So I know some people will be familiar with taping for their horses, but it's absolutely available for people as well, and is really great at stimulating good blood flow to those muscles to help them relax, helps to improve the vascular flow and movement, so we can help pump inflammation out of the area. And it actually acts similarly in the benefits of the joint adjustment, in the sense that it sends a little bit more input to our brain, kind of making us pay attention to something touching our skin, which actually helps to distract our brain from some pain and discomfort as well. So it's great for improving that muscle tension and getting those muscles to relax, but it also has a great pain relieving aspect as well.
Absolutely. And I know, as your patient again, that heat pad does wonders before you get started. That heat pad is like so essential.
Absolutely. That's always involved as well, for sure. Even on the hot days, that's something that's still always
it's
welcome.
Nice. It's really nice. So we did have a question pop up from Tom Shields. He says, if a person has low back issues and really wants to ride, do you recommend Western or English, sitting trot or posting trot?
Oh, that's a great question. So personally, I don't have a preference for what discipline you ride. I think whichever you are most comfortable with and most comfortable with, I am 100% on board. I just really would focus on making sure that you use good core engagement, so that we can really help support our low back and minimize the concussion that just our low back may take, so that we can really help just even out the stresses on our body and minimize the stress through our low back. And then as far as things like sit trot versus posting trot and, different sitting positions, there have been studies, not necessarily on the rider, but on the horse, to show that posting trot puts less concussive and pressure and force through the horse's back doing a posting trot, or even like a light seat. So whether it's a hunt seat or a 2-pointer, kind of just getting up out of the saddle, it just helps to minimize the concussion on the horse's back. And I can see that also correlating through the human's back as well, right? Because it's that concussive force that often really aggravates that low back. So sitting trot, it can be a little bit harder because there is just a little bit more concussion there. So as long as you can do a posting trot and really engage that core, I think that would be the best to minimize that force going through that low back. Not to say you can't sit trot, but it'll just help to minimize.
For sure. So that's a really great question, Tom, because something else came up. Obviously, the two saddles are different, right? You have the Western and you have the English saddle, or the dressage saddle we can look at as well. The Western obviously has a lot more of a deeper seat. It's very similar to dressage, and obviously it can be quite the Cadillac of of saddles, where the English is not so padded, so to speak, right? Especially for those jumpers that have that close contact. So is there, for someone that does have lower back pain, would it be better to go Western because you have that comfier seat, that deeper seat? Or like you said, have something like the English saddle where you can come up and do a 2-point, or, a lighter seat, or what would be the preference for someone with a lower back issue?
So for me, that's really going to come down to where the low back pain is coming from as well. So if it's coming from more the pelvis, if it's coming from more the lumbar spine, because those joints do function a little bit differently and take forces slightly differently between the two. And another big difference, in an English saddle versus a Western is going to be how wide set, the saddle is and how that affects you. Because for some people, say if your pain is coming more from your SI joints, having our hips set a little bit wider, or sitting on a wider horse, even if you're in an English saddle, but when you have a little bit more of that width and separation and abduction in your thighs and that hip joint, that is going to put a little bit of stress on those SI joints. So if it's your SI joints that are getting really aggravated, then that wider seat might just be stressing things a little bit more compared to an English saddle. But then that being said, if you can more comfortably engage your core and sit more comfortably in that Western saddle and take some of the pressure off your lumbar spine, so you're not having the same concussion because you're able to position your pelvis and your body more balanced, that could definitely be beneficial. Having that kind of wider seat and comfier seat where you can really relax but engage that core might be a little bit better if it's coming more from the lumbar spine. So I would really say it's going to be case dependent and horse dependent a bit as well. But those are some things that we kind of think of is what's the rest of the body doing when we're in those different saddles.
That's a good point. And that kind of gives us a segue into how riders' dysfunctions can actually have effect on their horse's performance. That's the big question of the evening.
Absolutely. So I know I've already mentioned a little bit as well, but especially if there's a pain component, but even if there's just a restricted component and we're really, unable to keep our weight evenly side to side, or as you had mentioned, if a rider's really feeling they're really having to shorten their stirrup or adjust their, saddle and shift their pressures through the saddle so that they feel like they are sitting evenly, that's going to put a lot of torque through the horse as well. So it's going to really be important as to how balanced you can sit and feel and how comfortably you can sit in the saddle, and really use yourself symmetrically side to side, because when we start to see those shifts and imbalances, you can see things like slipping of the saddle, which obviously, we make a big point to make sure our saddle fits properly. And if we start really shimmying that around because we're throwing our weight to the side, that's not going to be beneficial for our horse at all. And just even our control in how we are sitting in the saddle. So whether you're posting or doing sit trot or any kind of seated gait, if you're not able to really engage your body properly, and then you're going to be landing harder on that horse's back, they're going to feel the repercussions of that for sure. And whether it's through their ribs or through that middle area of their back or their low back, if horses are getting some mid-back pain, they're not always going to engage their hind end properly and cause themselves further like low back pain and pelvic pain themselves. Or, if we're really tipped forward in our saddle and we can't really sit back and use our body properly and keep our weight in a balanced spot, if we're really pitching forward, that's going to put a lot of extra pressure on that horse's forehand and then their neck and their shoulders and the concussion through that area. So it really is a global effect, having the rider shift and shimmy their weight, whether it's getting off of pain or because they feel like things are, not even when it's really themselves that are uneven. Or again, whether they just aren't able to utilize their body evenly side to side, even if there is no obvious component that they can feel and appreciate. If we're not able to really use our bodies symmetrically, that's going to have a lot of effect as we go through any gait in any discipline.
Awesome. So think about, you went through all those body parts on how you can help, but how can they be detrimental to a horse's performance? So let's say those hip flexors aren't as lengthening as we'd like them to be so that we can use our core and sit up properly. Mm-hmm. If those hip flexors aren't working the way they should, what kind of attribute can we see negatively on the horse?
Yeah, so again, like I kind of alluded to, and there's so much correlation between the human's pelvis, the rider's pelvis, and then the horse's pelvis. We're often going to see a lot of that hind end dysfunction, and that'll also affect our weight distribution through their mid back where the saddle's sitting. So if they're getting some kind of mid back pain from the saddle pressure, or just that pain that's transferring back to their hind end, then we can start to see things like, saddle soreness or sourness, but then also difficulties really engaging that hind end for that specific example. And everything we ask our horses to do involves a lot of hind end engagement, and that's a crucial part in them performing properly and taking the stress off the rest of their bodies. Just as a little aside, often if we have hind end dysfunction in a horse, we see a lot of effects further up through the body. And so if our pelvis and our mechanics through our pelvis aren't where they should be, and we're causing some of that stress and dysfunction in our horse, then we can start to see some hind end issues such as difficulty keeping and maintaining leads, or with lead changes, kind of that sourness to the saddle, or inability to really get their hind end under themselves and lift up through their back and engage their back to really round up, if they're getting some of that pressure and added pressure from the rider sitting unevenly in the saddle. And then, of course, all the upstream effects that can happen. But I really find that pelvic dysfunction in the rider can really translate to the horse and vice versa. So those are just a few of the things that we can see saying, okay, this horse might be having some dysfunction. And again, it could be coming from the rider.
Perfect. So you can totally use me as an example, but any kind of personal experience that you've had with riders that come in, they get adjusted by you, maybe you go out and get their horses adjusted, but do they have any feedback for you?
Absolutely. So I've, anything from pain to just improve mobility. So in particular, I had one rider who said he always had a difficult time really, bending with his horse and really kind of opening up in one direction. And associated with that, he was getting a lot of pain in like the side of his leg, and really had to just fight his position the whole time he was riding. And we've been able to really open him up and even him out side to side, and as well as get rid of that pain and allow him to be able to engage himself evenly and not put that extra stress on himself. So not only do we minimize that pain that he was feeling, but he was also really able to improve his symmetry while riding and effectiveness while riding. I've had other people say, hey, like, since I saw you, I had another lesson with my coach, and they told me how I'm all of a sudden riding straight. That was a problem that they had heard for many, many years, saying that they were always, really twisted to the side and weren't really sitting straight and riding straight. And, after very minimal treatments, their coach noticed a big difference in the rider's ability to really control their body appropriately. Other people, definitely with their position and being able to keep their shoulders back and not having to really fight through that shoulder and that upper back area, and really just be able to use themselves more comfortably too through activities, not riding related, but that were definitely playing a role in getting that dysfunction that was there to begin with. So their activities outside of riding were impacting their ability to ride well. So getting those areas worked on and adjusted helped with not only their, their job and the things that they're doing outside of riding, but also while they were riding.
I know you've helped me tremendously. You get my updates because we talk to each other so often. But when that saddle fitter said, it could be your hips, I went to a chiropractor. They did some x-rays. My hips were fine. So we couldn't quite figure out as a rider what was going on. And that's when I reached out to you and I said, look, you've got the rider background. You're an equestrian. You understand what we put our bodies through. Fix me is basically what I came to you and said. And it was funny because you found something my massage therapist, my other chiropractor couldn't find. And that was like one of my first ribs. And I know that my coach, he's always telling me, put your right shoulder back, put your right shoulder back. And I think I'm doing it, but clearly not, because he's nattering at me so often. So it just goes to prove, right? If your coach is nattering about you for one thing, you probably need to have something or someone look at the problem. And because I had dislocated my right shoulder years before, and holding my arm in front of me, it's put that scapula in a position where it peeks out. Mm-hmm. So when I'm riding, I have to actually consciously think of putting my shoulder back, and what feels like really far back is actually keeping me aligned. But again, one of the things you found was that rib, that one of those top ribs, and it feels great once it's relieved and you've put it back into alignment, but it made a world of difference for the way I ride my mare and how she was compensating for that scapula being a little too far forward, and how it makes a great deal for her mobility, and as well as mine, to be able to control my body position a little bit better. So I can attest to Kendle's work.
Well, thank you. And you bring up a great example on how it's not always just the things that happen while we're riding that can affect what we're doing while we're riding. So there's a lot of hours left in the day and days in the week where we're doing a bunch of other activities that can cause us to have difficulties while we are riding. So whether it's injuries, whether it's sitting a lot during the day for one reason or another, or using our bodies a lot more on one side than another based off of what we're doing, those all make a difference on the body that shows up onto that horse. So that's a really great example on it's not just what you do while you're riding, but how everything plays a role, and it's this whole holistic view on the horse and the rider and the performance.
Yeah, can attest to that as a massage therapist too.
Absolutely.
Do you yourself go get any body work done as a chiropractor?
Absolutely. Aside from, my sport injuries and things like that I have ever dealt with, definitely, being a chiropractor is not the easiest on the body either, as any manual therapist can attest to. So I utilize a combination of everything because it is so important to address, again, that whole body and not just one thing. So massage is huge, and I love my massage therapist. Acupuncture can be super helpful as well, and another great way to, address pain and discomfort and stimulate muscles. And then obviously getting adjusted. I definitely can tell when it's been, too long for me based off of the stresses I put on my body in between. And I don't ever want to let it get to pain, but I can definitely start to tell when things start feeling harder, than what they should to do, a basic activity. So I definitely use a combination of all of those things. Physiotherapy can be great as well, though, too, especially if there is some degree of an injury component that we're wanting to work over, or, if you're not going to go home and do some of the exercises that you should do, sometimes it's great to have that accountability to, go to a physiotherapist and go through stuff with them in person and really have them walk you through it. So there's a lot of great options out there to really help your body and help you perform as optimally as possible.
That's perfect. We have another question here for you. Mm-hmm. If the rider's seat is impeding the energy coming through, what are the issues likely to present in the horse? Back end or front end issues?
So this, we can see both. So it's definitely not a black and white answer. But often I find, it starts often in the hind end, and we can start to see it in the front end as the front end is trying to compensate for that hind end dysfunction. So even in people, and then in any quadruped as well, whether it's a dog or a horse or a cat, that hind end is super important. So what may seem like something super subtle and behind can actually really be a catalyst for things to show up on the front end because of the compensations that play a role. But usually it's hind end where it starts.
Yeah, I totally agree with that. Absolutely. That being said, when I go and work on a horse, when I'm assessing them and just got the visual of them, I can tell how a rider rides. I can tell if they're engaging that hind end or if they're letting the horse fall on their forehand, and I can almost guess what muscles are going to be tight. As a chiropractor and you just visually seeing that horse for like the first time, can you tell what kind of rider's in the saddle?
Oftentimes, yeah. So there's definitely some key components that are very common trends that, you know, you will see. And so there often are things that get put together pretty quickly before I get my hands on the animal. So, you know, definitely watching them go on a lunge line is super helpful as well. But you can definitely tell by the development of their musculature and their posturing and things like that, how they're using their body. And often there is definitely a component of how much the rider's asking, like how that rider's asking them to use their body, as opposed to just what the horse's natural ability is. The rider plays a pretty significant role for sure.
So basically, we're on to you, riders. We know you can't hide anything from us. We can tell by just looking at your horses what you've been up to. Getting back to the chiropractic care and riders, how often should a rider come and get an adjustment from you?
So this is something that is definitely going to vary from rider to rider. And, you know, like I said, I definitely try to make you, my patients, as self-sufficient, if you will, as possible. So in, you know, just talking about certain cueing to use while you're riding, or, you know, certain stretches or exercises to really focus on. So at that point, it is up to you to do those things to help maintain yourself as well as possible. So if you're someone who just doesn't even want to pretend they're going to, then there's a chance I'm going to have to be a little bit more involved in a little bit more higher frequency of care in order to help counteract some of those things. Now, if you are very willing and dedicated to doing your side of the work, then we can definitely get a lot more time in between how often you need the work done. Now, of course, things like history are going to play a really big role in whether you've had previous injuries, you know, how much of a pain component is involved versus mechanical component. And then, you know, just how everyone's going to respond a little bit differently. And it's, what are you doing? Again, the rest of the hours of the day and days of the week when you're not riding that are going to influence. So if you're putting a lot of extra stress on your body, especially asymmetrical stress, then, you know, that might require a little bit more extra work in order to settle those things down and even them out enough so that you're able to keep riding in a more balanced fashion. So it is definitely very patient dependent. I never have a set square black and white treatment plan in mind, and I always wait to see how each individual is going to respond, because there's a lot of factors that play a role in just how long you're going to notice any benefit from and how sensitive you are to those things as well. So there's a lot of different things. I definitely try to get as much time in between treatments as possible so that, you know, you're able to just keep going and enjoying what you're doing. Like, I don't want you to have to rely on me.
Yep, nope. And I know we're going to go through a few stretches and exercises shortly, but one of the things that just came to mind is obviously when I first started coming to you, I would have to come a little bit more frequent at the beginning, and now we go like once a month or something to come see you. But as a rider that's never had a chiropractic adjustment, is that something they can expect, is to come to you, but might have to do a little bit more frequent at the beginning and then slowly bring the areas in between and elongate them so that they're lasting a little bit more longer term?
Yes, absolutely. So when I first see you, I do want to follow up in a shorter time frame so that I can see how you responded. Obviously, I want to make sure that we're heading on the path that is going to make the difference for you. And so again, that's going to vary from person to person as to how much we're working on as well. If there's a lot of areas of dysfunction, or if we're just doing some little fine tuning, those things are all going to really make a big difference. Our body gets very used to being in certain patterns, and using ourselves in certain ways. And we have kind of this default of things that feel right just because we do them for a repetitive amount of time. So that's what our body thinks is right. And it doesn't always necessarily mean that it's the most efficient way or the best way for us to use ourselves. So that initial higher frequency treatment is definitely going to be to try and make sure that we are getting those adjustments and those changes that we're making to the body to stick. so that, again, we're able to maintain the work that we're doing, because it doesn't always just disappear overnight. I would love to say I can wave a magic wand and make it all disappear and everything go well. And it's just, the reality of it is that that's just not the case. So definitely in the beginning, it's just a little bit more frequent to see how you're responding to care, and if you're noticing those changes or improvements of our goals yet or not. And then as we start to notice those changes that we are looking for, then we start to draw those things out as you can tolerate. So I don't like to just say, okay, I'm hands off now, you feel better. If you have a problem, call me, years down the line. I do want to try and make sure some degree of a plan so we can catch things before they are painful and before they become a big problem, and catch the subtleties. But for some people, that's once a month or once every couple months. And for other people, it's maybe once every 2 or 3 weeks. It really varies from person to person. And then, of course, whatever that individual is most comfortable with, because it's a two-way street here. I'm not here to say what is always going to be best for you. It has to work on both parties and both ends.
Yeah, well, you'll be expecting a call from me this week, so I need to get in there.
We can arrange that for sure.
Perfect. And there's quite a bit of a humorous comment on the board here. It says, Kendle, at what point can you do horses and humans on the same day at the same barn location?
I love that question, and definitely something that I have goals to encompass and make happen. Definitely things that we can kind of talk about and see if it's something that we can arrange, but it's not something that's actively being offered right now, especially in the dead cold of winter. Who really wants to be laying still in a relatively cold barn with 50,000 layers on? When you're done, you want to go home and relax. So I definitely don't think winter is the time for that exactly either, but definitely something that you can look forward to seeing at some point in the future. So stay tuned.
That would be a really neat kind of clinic to go barn to barn to do.
Mm-hmm. That's something I've had in mind for a long time. So I really hope to put it into action at some point.
I would attend that too.
Awesome.
So last but not least, are there any exercises or stretches that riders can do to keep their body working optimally for their horses?
Most definitely. So I'm going to just reposition my screen a little bit here. So hopefully you guys can see me a little bit better.
And I will go full screen for you so everyone can see what Kendle's up to.
All right. Okay, so we will start here anyways. And I'm going to have to turn around a little bit, so I apologize if I have some technical difficulties with this cord wrapped around my head. But for starters, a big one that is going to be very helpful for things like posture and helping to keep the proper posture without getting some of that mid-back pain that you may get, and really hold those shoulders back and down without feeling like you're in some military position. So this exercise is called scapular retraction. And basically, I'm going to turn around here, and hopefully you can see my shoulder blades. So what you want to do is feel like you're pinching your shoulder blades together while drawing them down your back. Because when we're sitting up and we're riding, we don't want to hollow out our back and really arch our back, or cause any extra stress and overemphasize any particular areas, because we want to engage our body completely. So we want to engage the front area of our body as well as our back, as well as the sides. So this exercise is really nice to cue the proper muscles. So we're relieving some of the stress on our bodies while still keeping a really good position that keeps us nice and balanced on the horse. So I'm going to turn back around again here. So what you're going to do, I let my arms come to the side. You don't have to, but you want to pinch those shoulder blades together and feel like you're tucking them down your back. So you can also, if you're a very visual person, you can imagine having those shoulder blades move down your back and tuck into some pant pockets or back pockets. And you kind of want to tuck them into those pockets down your back. So that's a really great exercise to, especially if you're someone who is doing a lot of work during the day where you're maybe at a computer a lot and having your arms out in front of you and maybe hollowing out through the front of your chest. It's a nice way to really help to open up through the front of our chest, get some mobility through our back here, as well as really engage the proper muscles so that we're reducing some stress and strain on our bodies when we're riding. So that one is one of my favorites. I will also, I'm just trying to see how far my microphone can stretch here, so bear with me. Let's see. I'm going to move things all together I apologize, guys. I should have done a little trial run of these exercises. Okay. So this next exercise I'm going to do, it's called a cat-cow. You can see me a little bit here. So these are really nice to help just with some general mobility and just helping to kind of keep some good motion going all the way through our spine. So as you can kind of see, I'm on like a tabletop position. So I've got my hands and my wrists placed underneath my shoulders and then my knees underneath my hips. And what you want to do is this is like a common yoga pose and yoga sequence, so you may be familiar with it. But what you want to do is you want to take a nice deep breath in through your stomach so that your stomach actually expands with you. None of this breathing through our chest. We want to breathe through our belly. And so as you breathe in and let that belly expand, you also want to hollow out through your back and really let that back drop. So you can start to see, you wouldn't have bent elbows. I'm doing that just so you can see me. But you can see my back goes from being flat to really letting that belly drop down and kind of hollow out through our back. And then we're going to look up in front of us so that our neck is coming up as well. And we get a really nice scoop between our head and our low back area. And then after we take that nice big inhale where we're expanding that belly and letting it drop down, we're going to exhale. So we're going to really engage that core and contract. And you're going to round up so that you're in like a cat position, as if a cat was rounding their back, when they get angry. So you want to really suck that core and engage that belly and let that back come up. And then as you go to take that nice deep breath in again, you're going to let that back sink in and down. And then exhale, contract that core, and let that back round back up. So hopefully you were able to see that enough. I do have some of these videos also on my Facebook and Instagram pages. So feel free to go have a look at those as well, just so that you can get a little bit of a better view without me being attached to this microphone. So those are really nice just for some general mobility and really helping to stretch out some muscles as well as really open up through a lot of those joints in our back. So great to do before and after a ride as well, just to really make sure things are moving smoothly or as smoothly as possible. Next, I'm going to show you one to really help open up that hip flexor muscle that I was talking about earlier. So that iliopsoas muscle. So I'm going to just shimmy things around here one more time. Let's see. So we're going to tilt this down. Actually, this one might be better from here. Okay. So from here, you can do this particular exercise a couple ways, and there's different degrees of intensity. So I'm going to show you a more mild one, and then we can always talk to see if a deeper stretch would be more appropriate for you. So for this stretch, what you want to do is have a stable surface or like a little step up that you're going to put your foot on. So whether it's a stair or if you have a chair that can be braced up against a wall where you can have some support for yourself as well. Because the last thing I want anyone to do is tip or fall over. And so what you're going to do once you have that stable surface that is elevated for you to put one foot up onto, you're going to so I'm going to use this chair. So I've got my foot up on the chair, and I am otherwise standing with my other leg on the ground. What you're going to do next is imagine that you have a tail and you're going to really tilt that pelvis as if you were tucking that tail underneath you. So you're engaging your core muscles to help you do that and really engaging those abdominals as well so that you've got more of this flat back and your bum's tucked underneath yourself. So from here, you should already start to feel a stretch through the front of your hip on the leg that is standing on the ground. And then what you're going to do is you're going to bend further forward through that knee while keeping your body upright so we can really deepen a stretch through the front of our hip here. It should always feel like a good stretch, should never hurt or really catch you. If it does, stop doing it and it's not an appropriate exercise for you at that point in time. But this is a really nice way to open up through the front of that hip. And you can just kind of sit here, and in any stretch, instead of doing a count for how long you're going to hold it, I encourage you to take a couple big breaths through your abdominals and through your belly instead of breathing through your chest, because that's really going to help things relax and engage a lot of great muscles as well that you want to use while you're riding and doing everything in your daily activities. So once you kind of feel things start to ease up, You can bend or debend that knee and kind of relax and let things kind of settle down. And always doing things same side to side, even if you feel more tightness just on one. So now my right leg's my planted leg, my left leg's up here. I'm engaging that core and really tucking that pelvis and then bending forward just through my knee, not through my hips or my back. And then I'm feeling a stretch on my leg that's planted on the ground now. So hopefully you guys were able to kind of see that and appreciate which leg is doing what and where you should feel that good stretch. So that is definitely one of my favorites for opening up those hips. And there is a deeper one that can really target that area that much more. But again, it's just, it may not be the most appropriate depending on what work you've had done and what you're used to. So starting with the standing up one, if you've got a stable area to be in, that is definitely a good place to start. So those are kind of my top ones anyways. There's definitely some others that you can do if you really need to target certain strengthening exercises. So if we really need to get better core engagement, there's exercises like dead bugs. So I don't know if any of you have heard of that before, but they're a great way to get some core engagement during motion. So as I've mentioned before, engaging your core while you're riding is super important. And a lot of people, you know, they are like, oh, I don't have a core. We all have a core. So it's a really great way to stimulate using our core while we're going through movements instead of doing just like a crunch or, you know, a plank or things like that, because it doesn't really mimic that core engagement with the same movement that we're doing when we're riding. And then there's a couple other like shoulder stability exercises that can be really nice. But usually that's more if you've got some of a weakness that we really need to activate those muscles a little bit more than just, you know, your basic cueing for your positions while riding. So yeah, those are my main ones. Again, there's definitely a few others, but those are my go-tos for those different areas in your back.
And Kendall definitely gives you homework. And she always asks you how they're doing, so you can't pull anything on Kendall. She knows what you're all about. That was awesome, and those stretches do work. So hopefully some of the riders out there were practicing along with you and might take that home to do some of them on their spare time if they have any, or try even do it on their horses, right? Like doing the whole scapula in the pockets while you're riding. That'll get your shoulders back and then more centered, hopefully.
Absolutely.
That said, does anyone have any questions? I haven't seen any pop up, but if you have any questions, feel free to write on the comments under this broadcast, and we can definitely get them addressed for you. This is a perfect opportunity to do so because you've got Kendall right here, all for you.
Absolutely.
But I mean, the information that we went through with today, I think really gives those riders and those equestrians out there a really good foundation on what they can expect from their bodies in order to get that performance out of their horses. So, yeah.
Absolutely. Well, I really hope that, you know, you guys were able to pick up on some of that stuff too, that just the subtleties. It doesn't always have to be some big, dramatic, obvious problem for there to be something that we can fix and improve and just make you a more efficient rider. Because, you know, at the end of the day, we want to do the best for our horses, and looking after ourselves is definitely part of that picture. So I hope that as much as our animals, I know, are still always top priority, I hope that that's come through, and hopefully you prioritize yourself maybe a little bit more than you did before.
Yeah, well, and we're just here to share our knowledge, right? We love being able to help the horses, but at the same time, us as riders need to be helped as well. So it's definitely an opportunity for the riders out there to have a better understanding of what they can do for their horses in a different light, right? By taking care of them, taking care of themselves. Lots of thank yous going on this comment board that they really enjoyed this. This was awesome. We had a sarcastic comment of what's your favorite barn to go to.
Oh, goodness.
Yeah, just know that you're in the top 5 there. Top 5.
Always.
Lots of thank you. Awesome job. One comment was, I seem to get sciatic pain when I get on and I have to ride a few minutes without stirrups. Any suggestions?
Ooh.
Great question.
That is a great question. So again, it's going to be a little bit case dependent because there can be a couple factors as to why you're getting that pain, whether it's due to some muscles causing tension on some nerves or whether it is coming from some structures in your low back itself. So I don't want to, make any guaranteed claims, but definitely doing some stretches to open up some of those hip muscles, both through the side of our hip and our glutes. That area can definitely, when it gets a little tight and compressed and irritated, and we use that area a lot when we're stabilizing our position when we're riding. So that might be playing a role as to why you're getting some of that pain into your legs. So doing some stretches that really help to open up through the hips and the muscles through there. So things like a figure 4 position. I'm not sure if you're familiar with that, but basically I'm going to try and demonstrate it. Let me see. So you want to have an ankle. Let's see. There we go. You want to have your ankle crossed over your leg, so that you are in a 90-degree angle with that knee really driving towards the ground based on the position I'm in right now. And then if you're doing this from a seated position, then you can lean forward into this, and you should start to feel, so it's this hip over here that I'm feeling that stretch in, the one where my leg is at that 90-degree angle. So that's something that you might want to do before you ride, and just try and really make sure you get some mobility through there. There are a couple other positions that can target that area as well, but that one's really nice to stretch out one muscle in particular called piriformis that can sometimes cause some of that sciatic pain. So that's something that I would give a try anyways. But again, there are a few different structures that can present with that kind of pain. So we'd really have to hone in on what the cause is to give the most appropriate exercise to help with that.
Are there any other exercises riders can do at the barn before they saddle up?
For sure. So, I mean, even doing those psoas stretches, like I was showing, put your foot up on a bale of hay, and really stretch out through the front of those hips. Doing like modified versions of like what I just did, like that figure 4, if you can find somewhere to sit down, whether it's, again, a bale of hay or a bale of shavings, things like that, to sit down so that you can cross that leg over and then just lean forward and to stretch those hip muscles out, always on both sides before you're riding. Those are really nice. And opening up through the front of your chest too can be really nice, just to make sure that we're not getting tight muscles that are kind of pulling our shoulders forward more than necessary. So you can even like stand by a stall, have your arm up on the stall wall, and then open your chest out and away so that you're really opening up through the muscles in the front, and do that on both sides. I wouldn't go like super deep into it because doing a lot of stretching before you're using your body isn't always the best way to go. It really depends on what you have going on, but that can be just a nice little mobility thing to do without really feeling like you're getting like a ripping stretch. Just kind of making sure that you can go through that motion, let that shoulder come back before you're getting on to ride.
Perfect. Any other questions out there? Seem to be quiet at the moment, but again, a lot of people saying awesome job, really enjoyed it.
Oh, great.
So
I'm so
lots
glad.
of good feedback. Yeah, that's what we want to do, everybody. We want to be able to share our knowledge, educate you guys, answer your questions, make you better riders for your horses, and allow your horses to have the best performance. So that's why we're collaborating.
Absolutely.
And with that said, I can actually let them know what we're doing next, right?
Absolutely. Go for it.
So our tentative date for our next session is April 14th at 8 p.m. And this is when we're going to collaborate on a deeper level, and we're going to talk about why equine massage and equine chiropractics is really important for your horse's performance. We know we're getting into show season shortly, hopefully, fingers crossed that everything goes well for show season. And we want to make sure as a team that we can help your horses to be the best they can be in the ring and outside the ring. So make sure you have that marked on your calendars. That's April 14th at 8 p.m. We're going to collaborate again, and hopefully we'll answer some more really great questions. I'm pretty sure we're going to get a slew of questions at that webinar.
I can imagine. Get ready, guys. Write them down. I don't want you to forget them.
Yeah, start sending them in now so that we have them outlined. Well, I don't see anything else coming through. But obviously, I want to thank you so much for your expertise, your knowledge, your education, just sharing everything with us today. That it's great to hear from a different perspective for me. And obviously, all the riders out there, they're greatly appreciating you coming on and sharing with us as well. I've put your card up there on the broadcast here. This is the clinic that you work in for humans, correct?
Absolutely. Yep. So I'm definitely happy to answer some inquiries myself, but this is the best way if you want to book an appointment to get in. And there's always someone by the phone who can help you. Whereas if you're reaching out to me, I may be tied up in an appointment. So if you have some questions, definitely don't hesitate to reach out to me. But this is the best way if you do want to get booked in so you can get an assessment yourself. That is the best contact information.
And the clinic is wonderful. All the staff are very friendly. They've all got like their COVID protocols and they got it down packed. So it's really
Absolutely.
easy and convenient. And I love how it's quite in the heart of our territory, so to speak, Kendall. You're right in Font Hill. You're right on the main road there. So it's easy for a lot of our audience today to actually come and see you in person.
Fantastic. Well, if you guys know where Mossimo's is, it's tucked right back behind there. So usually everyone does know that particular spot. So come on by.
Perfect. Well, if there's no more questions, nothing's popped up. Thank you all for attending. I know we couldn't make this possible if we didn't have a wonderful audience and clientele base that's going to come and support us. So we both really appreciate all the support and the love that you guys have shared today. And we look forward to touching base with you again.
Absolutely. Thank you guys so much. And thanks for having me, Lauren. I had a great time.
Me too. We'll chat soon, I'm sure.
Sounds great.
All right. Take care of everybody.
Good night.
Bye.